is Jess. I'm a student physical therapist, and I'll be working with you today. Is that okay? And then can you confirm your name and date of birth?
Fernando Aguayo, 11/21/02.
Okay. And so I reviewed your plan of care with my supervising PT. It looks like I'm going to be taking some measurements of your hip, as well as doing some muscle testing and some special tests. Is that okay? Okay. How are you feeling today?
Okay.
Feeling okay? Pain,
A little bit of pain, mostly soreness.
Whereabouts?
I would say just. We'll say this.
Okay, so on your right hip, how would you rate it on a scale of 0 to 10?
It's mostly discomfort. So
Okay.
maybe like around 2.
Does anything make it worse?
Just running.
Running? Does anything make it feel better?
Icing and stretches.
I see that stretching. Okay. So what we're going to do, I'm going to have you lay on your back. Now I will be taking my patient into passive range of motion for hip abduction. So first off, I'm going to take her entire lower extremity and make sure she's nice and relaxed as I'm slowly moving away her lower extremity away from the midline. I'm going to do this for 5 repetitions and then making sure her opposite hip does not come up from the table. Now I will be instructing my patient to actively perform hip abduction for 5 repetitions, making sure that she does not internally or externally rotate her leg as she is doing this, and then making sure she does not let that contralateral hip come off the table. Now I will be performing the general gross strength for hip abduction. I'm going to have my patient lying side lying and making sure her pelvis is aligned. Asking her to go into hip abduction, that gives me a 3 out of 5. Then I'm going to stabilize above the pelvis and give max resistance for a 5 out of 5. Now I will be taking the hip abduction measurement using a goniometer. Normative values for hip abduction are 0 to 45. You'll instruct your patient to lie supine and palpate for the ASIS. Then your fulcrum is going to be on the ipsilateral ASIS. The stationary arm will be on the opposite ASIS, and the moving arm will be the anterior midline of the femur. So once you have your landmarks and your goniometer set up, you will slowly ask the patient, while keeping her foot in neutral, to move her lower extremity away from the midline, making sure she does not lift that contralateral hip. She got 44 degrees, which is within normal limits. Now I will be assessing the muscle length of the iliotibial band, which is also known as the Ober's test. You're going to position your patient side lying with the non-affected side on the treatment table, and the side you're testing is going to be facing up on the side. So you're going to bring their knee into flexion, and then you're slowly going to bring that hip into abduction and extension, and you're gently going to lower that leg, and if it reaches parallel to the floor, then it's a negative finding. The purpose is to assess the IT band tightness, and she got a negative test. So we're going to have to also assess the other side. So she's going to flip on her other side. I'm going to bring that knee into flexion, passively moving her into hip extension and abduction while stabilizing her pelvis, and then gently bringing that leg down. It is parallel with the other leg, therefore it is a negative Ober's test. Now I'll be assessing the manual muscle testing for the sartorius muscle. So your patient will be supine, and then I am instructing her to go into hip flexion, adduction, and external rotation, all in a partial range. So she's able to do this movement against gravity without resistance, gives me a 3 out of 5. And then now I'm going to be providing max resistance trying to push her into hip extension, adduction, internal rotation, and knee extension. She got a 5 out of 5 for that one. The next MMT is for the gluteus medius. So she's going to be sideline with the tested limb facing up. She's going to be in knee extension, hip extension, and I'm gently going to bring her into that hip extension with her toe dorsiflexed, and I'm stabilizing her pelvis. She is going to go into hip abduction. That gives me a 3 out of 5, and then providing max resistance here. She broke and I got a 4+. Now I will be performing the ELISE test to assess for a tight rectus femoris. Your patient will be prone and in hip extension. You're going to ask them to flex their knee, and if they maintain that hip extension, it is a negative test, but if they start to flex that hip, it'll be a positive test.